Living Spring Family Medical Center here in Mansfield, Texas. And I'm really excited to be here again. I want to say a big thank you to those who have sent questions, who have given feedback, and who have asked, that certain topics be discussed on this platform. So I'm going to start off today, before I go ahead and talk more about the topic, why is my doctor nosy, and how to maximize your doctor's visits. I want to tell you how this topic kind of came about. So um, I I've had interactions, of course, with many patients over the years, and I was featured on a podcast a few weeks ago. And one of the questions I was asked is, why are doctors nosy? They seem to ask and pray and ask a lot of questions, and I hope to answer that question. All right, so why are doctors nosy? So it there are many reasons as to why we're nosy, and it's not a question of nosiness. It's trying to find out the best way to care for you based on your history. So I want to teach you 6 things that you should know to help you maximize your doctor's visit, and that would also help answer the question why doctors seem nosy. So number one, it is important for you to know your history. So by that I mean, what medications have you been on before? What medical conditions have you had before? What's your family history? Is there a tendency for males maybe in your family to have high blood pressure? Is there a diabetic, is there a history of diabetes? Or are there certain cancers that seem to recur throughout the family? Breast cancer, colon cancer. So knowing your history will help your doctor also kind of know what the best way to or what the best approach it is to addressing your health concerns, and to also know what to screen for. And this is where annual physicals come to play. It's really important. I recommend this, once a year, typically around your birthday. You can make it part of the whole celebration. It's a new year for me. What are things I should do? I should go for my annual checkup. And that's where they'll ask all these questions. What runs in the family? What has happened to you before? What diagnosis have you been treated for in the past? So knowing your history is important. And this is where I actually get to see that people have issues in relationships. So some would tell me I don't talk to my brother, or I don't talk to my sister, I haven't seen my parents in a while. And that's where we get to uncover a lot of things as well. But knowing your history is good. So asking your siblings, asking your parents, are there any conditions that you've been diagnosed with? Anything in your aunts, in your uncles, in your siblings, and even sometimes in your children as well, can contribute to finding out information that would be helpful for you. So number one, know your history. Very, very important. Number two, write down your questions. So I did do a survey. I asked a group of doctors, thousands of them. I said, what are ways that patients could, you know, maximize their visit? How could they make it fruitful for both the doctor and for you? Because you come, to the doctor with expectations. How can we make it a good value encounter for you? And many of them said this. And number two, write down your questions. What questions do you have? And some people say, oh, I forgot I had some of them. So have a list, maybe on your phone. You could write out questions for the doctor, 1, 2, 3. And these are things you can present when you come in for the visit. And you can, sometimes people don't like to give it to the medical assistant. They usually ask you questions before you see the doctor. It is a good idea. It helps the doctor to prepare to better answer your questions. So number two is writing down your questions. Number three, bring your medication. Now, it doesn't mean the actual medication bottle, but bring a copy of the medication and the dose. You can take pictures and have it saved in your phone. Now, why is this important? I've had patients come, they say, well, I'm taking the pink pill. And I tell them, well, depending on what pharmacy is actually filling the prescription, it's hard to tell what pink pill exactly you're taking. So the name and the dose would be very helpful. It would also help with checking the interactions between, medications, making sure that the medications agree with each other. Sometimes the medications could explain your symptoms. So it's really important to know what you're taking. And I do want to mention here, make sure you divulge what herbs and special teas you're taking. I've had patients who say, "Oh, I'm not taking any medicine," and then we do blood tests, during the annual checkup, and the kidney function looks very elevated. And I ask, "Are you sure you're not taking any special herbs?" And then they are say, "Oh, yes, I do take this, but it's not a medication per se." But you want to let your doctor know the medications you're taking, the herbs, the supplements. Those are things that are important to divulge. Number 4, sign up for portal messaging. Now, in this day and age, especially with the advent of telemedicine, post-COVID and even pre-COVID, a lot of things are done digitally. So when you sign up for a portal message, you will be able to communicate with the medical staff, through your phone without actually having to, call and then wait. Having to wait and then having to have the doctor call you back. You save time. You can send a text message to your doctor's office. And typically, either the nurse or the doctor will get to read it. I do want to warn, though, this is not something that you would send an urgent message to, because it might take time for you to get a response to. But questions like, "Oh, doc, I had a question I forgot to mention, this, and that, and they can communicate back to you." So always ask wherever you go see. At our clinic, we do have the portal where you can actually send messages directly to me and I can respond back. Number 5, be honest about your habits. Please. You know, yeah, when I'm discussing with patients, I had one ask me, said, why must you know that? And I say, well, if you tell me what things you struggle with, is it drug use, is it heavy alcohol use, or you have a sweet tooth, then I can adjust, treatment modalities to accommodate to some degree what it is you're struggling with. For example, if I have a patient that says, I do have a sweet tooth, I do tend to indulge in this and this. Sometimes it's hard for me not to. I do it once or twice a week. I will educate. Let's cut down on the sugars, but I may need to increase your insulin, till we're able to kind of work through some of those diet changes to better control your diabetes. So being honest about your lifestyle, sexually, diet-wise, alcohol, and even drug use, drug abuse, because your doctor is there to help you. So it is very important to be open. And just so you know, by law, their legality is in place that ensure that that information is private. It's private for you, but please, it's for your own good. It is really important that you're open about your habits. And number 6, expect the visit to be nosy. We're doing an intake. We're getting to know you. We're getting to know what risk factors you carry and how we can best serve you. So when you expect that we're going to ask questions and pry in that sense, then you're not surprised. So it becomes a valuable visit for you. And we want the visit to be value adding to you. And so these are ways that you could prepare. So let's go over them again. We talked about 6 different things. We said number 1, know your history. And that's having conversations with your siblings, with family members, as to what medical conditions they have that could affect you. Number 2, write down your questions before you go to the visit, having them written down well so that way it can be addressed. Number 3, bring in your medications or a copy of your medications, the name and the dose, not necessarily the color. Okay. Number 4, signing up for portal messaging, because that way you can also communicate with the doctor concerns that you have that you may not have been able to discuss at the visit. Number 5, being honest about your habits. And number 6, expecting the visit to be nosy. Okay, so I do have a favor. I want you guys to, share this video with people who you think would be useful. It would be useful for. It would help people kind of get better prepared as they meet new doctors, as they go to see specialists and the primary care doctor. And I do want to encourage each and every one of you to please make your annual visits a priority. It's really important. I've given this example before. If you have a nice Maserati or Tesla or whatever fancy car you fancy, you wouldn't wait for it to break down before you actually took it for a checkup. In fact, you would take that baby, multiple times for a checkup, make sure the oil is clean, make sure everything is good. You are worth a whole lot more. So I want you to prioritize your health, and that means going for your annual checkup, maybe around your birthday, but at least once a year. So I want you to share this video. I am also going to put a link to my newsletter called Living Spring Echoes. I will send, if you're interested, you sign up, I will send a PDF copy of the ebook on how to maximize your visits. All right. So I want you to imagine this. You're going to see a new doctor. never met before. Of course, you're a little nervous. You're like, oh, I hope I like him or her, you know. But because you follow the six things, and you know what to do, you're prepared for the visit. So you're able to communicate your needs, your concerns. The doctor, from their own medical, from our medical standpoint, we're able to say, okay, great, I'll address these concerns, but these are other things I see based on the information you gave me. And so that way, it's a value adding visit for you. It would not just be, oh, I forgot to tell the doctor this, or I didn't feel like they answered my questions. When you do these things, you're better prepared. And I'm sure we'll be glad to see you because you are well prepared. Even if you're not, that's okay. We can navigate that. Um, I do appreciate, like I said, questions. Feel free to drop questions or other topics you would want me to discuss. Um, I'm really excited to be here, and thank you all for listening. You have a good one. Bye.